Thank you very much. So I've been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides. Wish it was done a long time ago. Today, we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. So, since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. You know, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. And they pump so much stuff into those beautiful little babies, it's a disgrace. I don't see it. I think it's very bad. They're pumping, it looks like they're pumping into a horse. You have a little child, little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. I mean, I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And you know it's artificially induced. It's not like something that also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the three should be taken separately. But with Tylenol, don't take it. Don't take it. And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot.
To meet the president's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. HHS will launch a nationwide public service campaign to inform families and protect public health. In addition to a possible acetaminophen connection to autism for pregnant women, infants, and toddlers, our research has revealed that folate deficiency in a child's brain can lead to autism. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine.